Hi, thank you so much. I am so excited to be here today and to be talking about such a rampant topic. PCOS has gained popularity and not for the right reasons. And in the last 2 years, because of COVID and the amount of time we've spent at home and the amount of sedentary lifestyle we've had and the emotional roller coasters we've been through, PCOS has really increased a lot. So this is something we should be discussing. This is something we should be having more awareness about. So thank you so much, Plum, for having me. I'm so glad that we're having this session. Other than that, I love this concept of this form of having women's health and sexual health, all of that filled up. So please, everyone, I urge you all to fill this form because this is a really helpful initiative, and you all should definitely go ahead with it. I think the link is in the chat box, so please go ahead and fill it. Sabha, do you want me to start?
Yeah, you can get started.
Okay, so everyone, I am going to be presenting the topic of PCOS to you. Don't consider this a lecture. Don't consider this, a board and teacher telling you what PCOS is. This is not your biology class. This is not a class in medicine, but this is me trying to make you as aware as possible about one of a very major syndromes which is rampant among women in reproductive age group. Just sharing my slide. Is it visible?
Yeah, we're good.
Okay, great. First things first, PCOS is not a disease. Let's get this straight and out once and for all. PCOS is a syndrome. Now, what exactly does a syndrome mean? A syndrome is basically a collection of lot of symptoms coming together from different organs and different systems in the body. So what exactly is happening in PCOS? Polycystic Ovarian Syndrome. Even though the name just suggests that it's cysts in your ovaries, it's a misnomer. It's not exactly cysts. It's multiple small follicles and small eggs that have not been released that are getting formed and collected in your ovaries. Now, while this is happening, there's a lot of hormonal disruption. Now, women usually have estrogen, progesterone, luteinizing hormone, and the follicle stimulating hormone in normal quantities, as well as testosterone, which is actually a male hormone. Yes, women do have the male hormone in certain quantities as well. But because of the disruption in your ovary, there is increase in this male hormone, which is causing a lot of disbalance and imbalance in the rest of your body. That in turn leads to insulin resistance. Insulin basically is something that is released from your pancreas, and it helps convert your food into energy and get utilized. Now, when insulin resistance takes place, that is when the sugars that you eat get stored in the form of fat, and the sugars in your body increase. So then there's insulin resistance. Now, because of excessive follicles in your ovaries, your ovulation is not taking place. Because ovulation is not taking place, ovulation is a monthly cycle, which is supposed to happen every month. Your ovaries are supposed to release eggs every month in a normal situation. But because of all this ghotala that's going on, this does not happen, which is why there's anovulation or oligo-ovulation. That means you may not get your period on time, or you may have irregular periods, or you may get periods after a very long time. So yes, this is overall what PCOS is. Now, these sacs, the follicles in your ovaries are getting collected and they're not getting released. Now, obviously, if there's no ovulation, it also becomes difficult and harder to get pregnant. Let me tell you, PCOS does not equal infertility. Very few things that need to get cleared out in advance and need to be repeated again and again for you. PCOS does not mean infertility. Now, what exactly helps us know how to find out if one has PCOS? Now, first of all, there is a criteria that we all follow. This is something you may notice in yourself, and this is something your doctor will ask you questions about as well. This is known as the Rotterdam criteria for PCOS, which is very famous. It has a trilogy of irregular periods. It has multiple follicles in your ovaries, and it has high androgens. Androgens are basically your male hormones. Now, who is basically at risk? Women between the age of 15 and 44. Now, why do we say that? Because these are the women in their reproductive age group. These are the women who are normally ovulating. These are the women who have started their period and are towards ending their period. So this is the age group that is most susceptible to getting PCOS. Now, why we're talking so much about PCOS these days is because it has increased a lot in the last 2 years. Like I said, COVID has been one of the major factors in increasing, the prevalence of PCOS. And why we need to discuss it because there's a lot of people spreading misinformation about this. I need you to understand that there's not one particular person or one particular medicine that is going to treat your PCOS. PCOS is not a disease. It does not have a treatment. It only has a management. So let's get to the nitty-gritties of it. Now, like I told you about the Rotterdam criteria, how do you know and how do you figure if you are someone who may be suffering from it? One, you may have irregular periods, or you may have very, very less amount of bleeding during your period. Now, suppose you're someone who has had bleeding for 3 to 4 days and are someone who's changing your pads 3 to 4 times a day and are suddenly experiencing very, very less number of days of bleeding. That is one of the signs. Two, you would start experiencing a lot of hair loss from the middle of your scalp. This is known as male pattern baldness. It's something that occurs because of the high levels of male hormones. The other thing that you'll notice is central obesity. Central obesity meaning, like you've seen, I don't have anything against males or the male hormone, but this is something that we need to understand. When a male starts getting heavy or starts getting overweight, most of the weight starts getting collected in the middle of their body. That is the trunk. So truncal obesity or central obesity or obesity just around your stomach, that is the kind of obesity you will observe. Then you may start observing a lot of acne. This acne is usually placed in the lower area of your face, on your chin, on your chest, on your lower back, and your upper back. Then you may start experiencing a lot of unwanted hair growth. This can start being seen on your face again, on your abdomen, somewhere around your breast, and even on your back. Now, if you're someone who has not had any of these symptoms before and have started experiencing this, this is your alarm where you need to go and visit your gynecologist and probably have things ruled out. Other than this, what you may also experience is a lot of tiredness, exhaustion, fatigue that is not explainable, right? And you may experience a lot of decreased libido. That is, you will not want to have sex. That happens in a lot of women, and this is something you don't want to deal with, right? So you need to understand that these are your alarming signs and symptoms for which you need to go to the doctor. Here are a couple of pictures that can help you understand what symptoms of PCOS actually look like. Hirsutism is facial hair growth, acne, balding, which is right in between in your scalp, and a lot of hair loss. What you may also see is darkening of your skin. You may feel that you've not had a proper bath and you've not cleaned yourself properly, but you start seeing that there's an appearance of a black line around your neck or your underarms, under your breast, or on your abdomen. These are all signs that you need to go to your doctor for. Now, what exactly causes PCOS? This is a question a lot of us have not been able to answer for the last 100 and 150 years. We don't know the exact cause of PCOS, but there's a lot of risk factors. One is genetics. If someone in your family is having PCOS, like your mother or your sister or your paternal aunt, there is a possibility that you may have to deal with it as well. In such a case, it becomes important that you try and prevent it than try to cure it, because no cure, right? Other than that, insulin resistance. If someone in your family is a known case of diabetes mellitus, or you are a known case of diabetes mellitus, the chances of you having PCOS become very high. Next, obesity. No talking about body shaming over here, but this is how it is. Obesity is unhealthy. Being overweight and not having the BMI you're supposed to be having is something that leads to a lot of lifestyle disorders, including PCOS, and obesity is one of the most important risk factors of PCOS. The next being inflammation. When I talk about inflammation, I mean any long-standing disease or any long-standing disorder that you've had. like any infection that you've had for a long time, or tuberculosis, or any other hormonal disorders, like raised levels of prolactin or any thyroid disorders. These are all your triggering factors that may lead to an increased chance of getting PCOS. Now, what are the kind of tests that will get done if you as a patient come to me and are presuming that you may be having PCOS? What are the kind of tests that I'll do? First of all, I'll look at you. Just by looking at you, I may try and understand whether you may be someone who's suffering from PCOS or not. So on physical examination, I'll look for your acne. I'll look at your hair, whether there's any balding. I'll look at your whole overall nutritional, build, whether you're overweight or not, whether you're underweight or not. Let me get this out of, the box, that if you are overweight, it does not mean that you're definitely getting PCOS. And if you're underweight, it does not mean that you're not getting PCOS. So someone who is overweight may not have PCOS. Someone who is underweight or very lean can also get PCOS. Then we'll do a pelvic examination to make sure that there's no other type of disorder, no other type of abnormality in your uterus, in your fallopian tubes, or in your ovaries. This examination is basically done with a speculum or by inserting 2 fingers. That is something people are not very comfortable with, so we usually avoid that part. Then we have a couple of blood tests to check your hormones, to check your sugar levels, to check your insulin, also to check your lipid profile and all your fat levels in the body, also your cholesterol levels. There are times where your cholesterol is also deranged with PCOS. Your good cholesterol becomes much lesser and your bad cholesterol is increasing, which also increases the chances of obesity increasing with PCOS. After which we do an ultrasound. On an ultrasound, we check your ovaries and we look for the presence of these tiny follicles in your ovaries. If we see anything above, a volume of more than 10 to 12 cc in your ovary, we start suspecting PCOS, along with the remaining symptoms that you are talking about. Now, what happens if you let PCOS just be? What happens if you're not taking care of it? And what happens if you don't manage it? Well, PCOS unfortunately does have long-standing complications for your body. Now, in adolescence, there will be development of insulin resistance, like I told you, which could lead to diabetes, which could lead to obesity, which could lead to a lot of male hormone in your body, which again may not allow you to get pregnant, and your period will not come for long periods, sometimes even 6 months. After which, when you are in your main reproductive age group, you'll have decreased libido, you'll have a lot of, depression, anxiety. It could increase the chances of one developing endometrial cancer. Metabolic syndrome. Metabolic syndrome is a syndrome where your sugars are raised, where your blood pressure is raised, and your body's cholesterol levels are raised. All these are very, very high risk factors for you eventually, not having longevity. Like I said, post-menopause, chances of cancer increase. Now, coming to pregnancy and PCOS. Like I said, PCOS does not equal infertility, but PCOS does mean subfertility. Now, what is subfertility? It means that the chances of you being fertile become much lesser. You're not as fertile as someone without PCOS. Why is this? Because you're not ovulating like someone else, because you're not getting a regular period, because your hormones are deranged. They are all tipsy-turvy and haywire. So what we need to do is, for pregnancy to occur with PCOS, we need to give some ovulation-inducing agents, which help you get pregnant, and further on, treat that. We'll come to that later. Other than this, if we have PCOS untreated and someone eventually does get pregnant and has all the risk factors associated with PCOS, like hypertension or high sugars, or even obesity, the chances of having a premature labor or a miscarriage become very high. So yes, leaving PCOS is just not an option. Now, how do we manage PCOS? No particular cure, no particular medicine, no particular surgery for PCOS. It's always a wholesome, a holistic approach. So what we do is, we first of all always start with lifestyle management. Your PCOS is 90% in your hands and 10% in my hands, and in the hands of the other experts that are helping you out. So always remember your lifestyle management, that is having, a balanced diet, having enough exercise, having enough sleep, and having a stress-free life. This is what is going to help you reverse PCOS. Not cure it, not treat it, but try and reverse it or at least have it under control. So that is the first, very, very first thing. The second, we do try and give oral contraceptive pills to try and regularize your periods. Now, these pills have a combination of estrogen and progesterone, which are hormones which are regularly available in our body. Now, with PCOS, because these hormones are deranged, we try and give you an add-on of these hormones so that your ovaries are fooled into thinking that your body has normal amount of hormones, and that makes you ovulate. That also makes you get your period every month on time. Then we have something known as insulin sensitizing agents. Now, these are agents which are also used in patients with diabetes mellitus, but these will help not let the sugars get converted into fat. So once you eat something, instead of it getting stored as fat, your body starts using it as energy. You find it easier to lose the excess weight, and you find it easier to manage the PCOS. Then we have vitamins and supplements. We've seen a large correlation between vitamin D deficiency and vitamin B12 deficiency with PCOS. So we try and give supplementations with vitamins. This helps you combat PCOS as well as improve your lifestyle changes. Coming to skin treatment, we have a variety of skin treatments available for PCOS. One being topical ointments that your dermatologist will give you. Two, there can always be a laser treatment done for your excessive hair growth, but this is only after we bring your male hormonal levels down. If your male hormone levels are high, there's no chance your laser treatment is going to work. So if you had excessive hair and you've gone to your dermatologist and just asked, for a laser treatment, remember, it's not going to work until and unless you have your testosterone levels checked. Then when it comes to pregnancy, we have ovulation inducing agents. These are basically agents which help your ovaries release eggs smoothly and fast in order for a pregnancy to occur. Now, just a quick way of how pregnancy works. Your ovary will release an egg. The sperm will meet the egg during your ovulation. That is how they'll meet in your fallopian tube. It will travel down to your uterus, and your uterus will grow the pregnancy into a baby. So for you to ovulate, you may need an ovulation inducing agent. Then we have surgery in cases that, lifestyle management, pills, insulin sensitizing agents, and ovulation inducing agents are not working at all. We go in for surgery. What we do is we go in with a laparoscope, that is a tiny camera, and we make a small hole into your abdomen. The ovary is pierced and the tiny, tiny follicles are released. So this helps us bring your ovary back to normal size and tries to release the excessive follicles. It's not a 100% cure. It does not mean your PCOS will not come back. It does not mean you will definitely get pregnant. But yes, it is used in cases that are not responding to any other form of management. Now, like I said, PCOS is a syndrome and it has a lot of organs and systems involved. It obviously has a lot of experts involved in helping you manage it as well. So first, when you experience these kind of symptoms, you'll go to your gynecologist. Your gynecologist will then refer you to the remaining people if you're having any other symptoms. So who else helps you? A dermatologist will help you. An endocrinologist is someone who deals with hormones. So an endocrinologist will be helping you. A nutritionist will help you have the perfect diet that suits you. Then you have a psychologist, a psychiatrist, or a therapist who will help you with the entire emotional trauma, the exhaustion, the fatigue, the decreased sexual arousal that you're having, and fitness experts, of course. They will help you with what kind of exercises, with how long your exercise has to be, whether moderate or high intensity, and all of that. Now, what is your take-home message with this whole presentation and this whole talk? One, PCOS is syndrome and not a disease. This is what you go home and tell everyone today, please. PCOS can be managed and it can be controlled. It can even be reversed, but it cannot be cured. PCOS can very, very well be prevented. It does not equal infertility. Having PCOS does not mean you cannot get pregnant. And having PCOS is not the end of your life or the world. Thank you.